All right, first nerve we're testing is the olfactory nerve, cranial nerve 1. So to do that, I'm just gonna have you close your eyes and cover one nostril. I'm gonna hold a smell under your nose. I want you, if you smell it, to tell me what you're smelling. Sound good?
Yes.
All right, so go ahead and close your eyes. Cover your right nostril for me.
Vanilla.
Okay. Keep your eyes closed and cover that other nostril for me.
Peppermint.
All right, awesome. So an abnormal finding for that one would be if she couldn't smell anything or if she was unable to distinguish what she was smelling. So now we'll be testing part of the optic nerve for her visual acuity. First test is the Snellen eye chart. So I'll be standing close to the patient in order for safety. And then I'm gonna have you read, actually to first start, I'm gonna have you cover your right eye for me. And then go ahead and read line 8 for me.
D-E-F-P-O-T-E-C.
Okay, go ahead and cover the other eye. And can you read that line backwards for me?
C-E-T-O-P-F-E-D.
All right, perfect. An abnormal finding for that one would be if she was unable to read the line. So we're going to be assessing your optic nerve continued here. We're going to be doing your peripheral vision. While I'm doing this test, I just want you to look right between my eyes or right at my nose. And I have these two pins. I just want you to tell me when they come into your field of vision.
I see him.
Okay? Keep looking between my eyes.
I see him.
Okay, awesome. Abnormal finding there would be if her field was too small or if they were asymmetrical. All right, so now testing the optic nerve, your pupillary light reflex. I'm gonna just be shining a light. Once again, just look straight at my nose here. I'll be lightly shining a light in your eyes and I'm just gonna be observing the pupil response. Okay. All right. An abnormal finding would be if one of her pupils constricts and the other one doesn't, or if neither of them do. So now I'll be testing your tracking ability with your eyes, which is going to be testing cranial nerve 3, 4, and 6. So what I'm going to have you do is just track this pen. I'll have you look at the tip of it, and if you experience any symptoms of dizziness, nausea, blurred vision, I need you to let me know. Sound good?
Okay.
All right, so look right at the middle of the pen, and I just want you to track where I'm moving with it. So what I was looking for there is clear pursuit of the pen. Abnormal finding would be overshooting, inability to look in a certain direction, any of those symptoms I mentioned before. So I'll be testing Saccades now, which is still cranial nerves 3, 4, and 6. So what I'm gonna have you do, this is green pen, red pen. I'm gonna be holding them right here. Can you see both of these?
Mm-hmm.
I'm gonna say a color and I just want you to look at the pen. Sound okay? Red, green, red, green, red, green, red, green, red. Perfect. So abnormal finding would be overshooting those targets. All right, so we're gonna be testing the trigeminal nerve now. To start, we'll be doing light touch sensation of the ophthalmic, maxillary, and mandibular branch. So what I'm gonna be doing is I'm just gonna be touching these cotton balls to your face. That's what they feel like. I'll have you close your eyes and I just want you to say yes if you feel it.
Yes. 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 Yes.
Okay. And now I'll do the same thing, but I'm going to touch at the same time, and I just want you to say yes if they feel the same.
Okay. Yes. Yes. Yes.
Okay. Abnormal finding there would be if she was unable to feel that light touch sensation. Okay, so now I'll be testing sharp dull sensation of the trigeminal nerve, once again, ophthalmic, maxillary, and mandibular branches. So I'm gonna go ahead and just sterilize this super quick. So I'll be using a safety pin here to do this test. I'll go ahead and just demonstrate on your hand. So the sharp feeling just feels like this, and the dull feeling feels like that. Sound good? So when you feel those feelings, I just want you to say either sharp or dull. Sound good? All right, so I'll have you close your eyes for me.
Dull. Sharp. Sharp. Dull. Dull. Sharp.
Okay, perfect. Abnormal finding would be if she couldn't distinguish the two or didn't feel them, and then also hyperalgesia with the sharp sensation. Okay, so now I'll be testing muscles of mastication for trigeminal nerve. So the first thing I'm gonna do is I'm just gonna have you clench your jaw for me. Okay, perfect. And then I'm gonna apply a little resistance here. I want you to just open against that resistance. Great. And now keep it there. And then I'm gonna say close against resistance. Perfect. And then I'm just gonna test your jaw jerk reflex. So go ahead and just relax your jaw for me. Okay, perfect. Abnormal finding there would be asymmetry of the jaw muscles, any pain with those jaw muscles, and then abnormal jaw jerk reflex. All right, so now we're testing the facial nerve, which is responsible for taste on the anterior 2/3 of your tongue. So I'm gonna have you close your eyes. I'm gonna dip this Q-tip in either salt or sugar, and I just want you to tell me what is being wiped on that anterior part of your tongue. So go ahead and close your eyes for me and stick your tongue out.
Salt.
Salt, okay. And stick the tongue back out for me, please.
Sugar.
Okay. An abnormal finding there would be if she wasn't able to taste either of them or discern between the two. All right, so now I'll be testing your muscles of facial expression for your facial nerve. So I'm just gonna have you smile for me, frown, raise your eyebrows, close your eyes real tight, and then puff out your cheeks. Okay, perfect. Abnormal finding is if she's unable to do those motions or if it's asymmetrical for either side. All right, so now I'll be testing cranial nerve 8, vestibulocochlear. So I'm gonna be doing some hearing tests. So I'm just gonna hold this up to your ear. I just want you to say yes if you can hear it.
Yes.
Okay. And then tell me if you can hear this as well.
Yes.
Okay. Which one's louder?
The one right by my ear.
Okay, I'll do the same on the other side.
Yes.
Okay.
Yes.
And which one was louder there?
One right by my ear.
Okay. And then tell me if you can hear this.
Hmm?
Do you feel it equally on both sides?
Yes.
Awesome. Abnormal finding would be if she couldn't hear equally on either side for the top of the head, and if she could hear through the mastoid process louder than by the ears, which would indicate a conduction problem. All right, so now I'll be doing your vestibulo-ocular reflex for cranial nerve 8. So for this one, I'm just gonna have you look right between my nose, keep your eyes fixed on that point. I'm gonna slightly tilt you down just a little bit. And then as I'm doing this, I just want you to let me know if you're having any symptoms, dizziness, nausea, any discomfort with it. Good. So abnormal would be if she did have any of those symptoms, if she couldn't keep her eye fixed on my nose, and if she had any loss of consciousness or nystagmus. Okay, so now I'll be doing the Dix-Hallpike test for cranial nerve 8. So as we do this, I just want you to let me know if you're having any dizziness, headache, blurred vision, nausea, anything like that. Sound okay?
Okay.
All right, so what I'm gonna do with this one is I'm just gonna slowly rotate your head this way, and I'm just gonna kind of quickly lower you down. I'll have control of you the whole time, but I'm just gonna kind of let your head hang off the side, and I'm just gonna be observing your eyes. I just want you to keep your eyes open for me. Sound okay?
Mm-hmm.
All right, so we're gonna go down in 1, 2, 3. And I'm just gonna hold this position here for 30 seconds. So you just relax, and once again, let me know if you're feeling any discomfort. Doing okay?
Mm-hmm.
Perfect. Doing okay? Good. All right, and we're gonna come on back up. And how do you feel right now?
Good.
Okay, awesome. Good job. So now I'll be doing Dix-Hallpike on her opposite side. So I'm going to be doing that same test again. Once again, same symptoms. So I'm going to quickly lower you down. I'm going to tilt you this way, and we're going to go down in 3, 2, and 1. And once again, keep your eyes open. I'm just going to be observing. Let me know if you have any of those symptoms, and we're going to hold that for 30 seconds. Feel okay?
Yes.
Good. We're gonna come on up, and you feeling okay right here?
Yes.
Any dizziness? Okay, perfect. So abnormal finding would be any of those symptoms I listed above. Okay, so now I'm gonna be testing your cranial nerve 10, the vagus nerve. So the first thing I'm gonna do, I'm just gonna kind of palpate here. And I'm just gonna have you swallow for me there. Okay, perfect. And then I'm just gonna have you open your mouth real big for me and stick your tongue out, and then just say ah.
Ah.
Okay, perfect. What I'm looking for there is asymmetry with her swallow muscles, as well as asymmetry with her uvula as it contracts when she says ah. All right, so now we're testing spinal accessory nerve, which goes to the SCM and the trap. So I'm gonna have you rotate your head to your left. I'm gonna resist here. I want you to push into my hand. And I'll palpate the SCM, and it is pushing into me. Now go the other way. I'm gonna palpate here, push. There we go. Perfect. And then I'm gonna have you shrug your shoulders up as high as you can for me, and then resist me pushing you down. Okay, perfect. Abnormal finding there would be if I'm unable to palpate her SCM, or she's unable to resist that rotation, and if she's unable to resist me pushing down her traps, or if it's asymmetrical with either direction. Alright, so now I'll be testing cranial nerve 12, hypoglossal. So all I'm gonna have you do for this one is just stick your tongue straight out like you're trying to catch snowflakes. Perfect. Good. Abnormal finding here is if the tongue was to deviate to either side abnormally.